Hello, and firstly, thank you for downloading my free guide to improving your knee pain. So my name is Andy Ellis. I'm a physiotherapist and I am owner and founder of AME Physio and Sports Massage Therapy. So this program is going to basically involve an explanation, particularly in this video, of why you get knee pain and the fact that I tend to find often contribute to knee pain and what you can kind of do about it to improve your knee pain. And I will also provide a few drills that I've found quite useful to often help with your knee pain as well. So if we look at this model of the knee here, what you'll see is obviously you've got your kneecap, you've got your quad tendon, you've got your patella tendon, this is your tibia, and obviously your femur as well. So what different things can cause knee pain? Well, I tend to find often one big factor is tibial internal rotation, and obviously we'll include a drill about that within this program to try and help with that. So the shin, imagine this, that is the shin's ability to be able to turn inwards when the foot obviously pronates. So a lack of tibial internal rotation, particularly if the shin is stuck outwards into external rotation, can often stress the inside of the knee and cause pain. So that tibial internal rotation is crucial. The other things that can often impact, which I've said in my, if you check out my free guide to unlocking your foot and ankle, is the foot and ankle itself. And if you check that guide out, that's quite a useful guide as well to try and help ease some of your foot and ankle pain, but also your knee pain. So actually, if the foot has a lack of ability to, which I'm not going to really explain too much in this video because I've already explained it in the free guide to unlocking your foot and ankle. If the foot lacks the ability to dorsiflex at the forefoot, the heel lacks that ability to be able to evert the heel and plant flex the foot. And also if you lack big toe extension, all these are factors that may contribute to that knee pain as well. One other thing that I find is that where you've got the knee here, you'd obviously have your quadriceps, which are on the front of the thigh. So that will kind of be the muscles on the front of my thigh here. And often when they become very, very tight, it can often stress like your quad tendon, your patella tendon, and the knee itself as well. So really we should be able to get our heel to our bum if we're doing like a passive knee bend. And if you can't, then sometimes you work on actually the quadriceps length. That can often help with your knee pain as well, because if you've got very, very stiff quads, you can't get that knee bend. How are you supposed then to get down to be able to do that lunge, that squat, kneeling, etc. Often if we address the quad length, that can help massively with obviously the knee pain as well. The other one is actually tightness in the muscles on the back of the thigh, because sometimes if they're tight, it can lock you into a little bit of a knee bend, then so actually we have that lack of ability to be able to straighten the knee itself. Other factors that I sometimes find as well, if the kneecap is very, very stiff and not likely to move, again, this might be due to some stiffness around your quadriceps, etc. If we get the patella actually moving better, that can help with your knee pain massively as well. So obviously we've got all the foot mechanics, which we speak about in the you discover your free guide, to unlocking your foot and ankle. You've obviously got the quadriceps length, your hamstring length as well, your tibial internal rotation. They're often the main kind of factors that I find really that often affect the knee. The other ability as well, which we kind of delve a little bit into more in this program, is essentially the coordination and co-contraction of the muscles around the knee. So what the coordination and co-contraction means, it basically means that all of those tissues working together to enable you to be able to bend and straighten that knee, to be able to propel forward in gait and that sort of thing. So often, if what should really happen is the quadriceps, the calf muscles, so your quadriceps here, your hamstrings, your calf, your glutes, everything like this should all be working together. And if something in that chain is not doing a good job, this can often predispose to knee pain. So hope that kind of makes a lot of sense of why we might kind of be getting some knee pain there. If you check out the other links and the other exercises, hopefully you find this program useful, and hopefully this tries to address some of the issues of why we might kind of be getting this pain. Thank you for listening.